You ready, Patrick? Good morning. Welcome to the Cook County Public Health and Human Service Board meeting this morning. I will have us look at the agenda and have an approval there, unless you want to pull anything.
Motion to approve.
Support.
All in favor? Aye.
Yes, thank you. I'm getting the big one. Yes, that's the one.
Is that okay?
Yes, thank you, means you approve.
I didn't look out there and I
Okay,
said
he
white.
approves.
I approve.
Well, this morning we're going to have a staff presentation from the Sawtooth Mountain Clinic with Teresa, Rita, and Hartley. Welcome to our meeting.
Thank you.
So we'll let you take over.
Should I take over? Thank you very much. One of the, well, for those of you who don't know me, I'm Rita Plurd. I'm the CEO of the Sawtooth Mountain Clinic. I wanted to thank you for inviting us. Thank you, Allison, for inviting us. And for some amazing reason, all of us were able to show up at the same time when Allison sent a request last week, so I'm really pleased to be here. We wanted to take you through just a quick run of what we've done as part of the outreach program and as part of our collaborative with the Public Health and Human Service Program. I think that last night when I was thinking about a little bit of information for the introduction, that one of the pieces that came to me is that this must be my year of 20s, 30s, 40s, 50s. It must be a decade kind of thing. We have been in this relationship with Public Health and Human Services for going on 21 years. Sawtooth Mountain Clinic has been a federally qualified health center as a nonprofit 501c3 going into our 40th year. So, and I really am not going to admit how many years I've been working there. It might be going into my 60th. I'm not 100% sure. But it's been great, with great pleasure, that we've been able to work with you, work with the staff at the county, and we really appreciate what this collaborative has provided for us over the years to expand our services. And as a federally qualified community health center, we are really supported to be able to go out into the community to reach out and quite honestly meet any needs that are there in whatever fashion they are. I have colleagues that actually have to focus on public housing because that's a need in their community, where we've been focusing on more physical, active, health-focused, clinical-focused issues throughout the whole Cook County and Grand Portage. We work very closely with the Grand Portage Health Services and feel very, very grateful to have that opportunity also. So I also wanted to briefly mention that last night I went back to look at numbers from 1998 when we began, and I couldn't really find numbers. We have so many numbers that I couldn't find numbers. I think that we, as community health centers, have been tracking data both in clinical and qualitative measures since we became in existence. But in 1998, when we began this relationship, it wasn't as much the numbers as it was identifying the services that the peoples of our communities were looking to need and to expand upon. So what I was struck by is that back then we all seemed a bit flush with dollars, which I know is not how we feel today. Well, I should speak for myself. It is clearly not how I'm feeling today. But one of the interesting things was that we actually are providing more services today than we did in 1998 with half the dollars, half the budget, approximately half the budget that we started our relationship with. And in many ways, you know, depending on how you look at that, you can interpret it in many ways. But I think that one of the beauties of that is that we, as a collaborative, are extremely committed to meeting the needs. And if it's with less dollars, we will do what we need to do to meet the needs of the people. So I feel very grateful to have that opportunity to do that. Do you want to quickly jump? There's a slide in here which I was saying to the staff, which I have to give, you know, really, I really don't do anything. Really, it's the staff that I have great pleasure to work with that really does the awesome work. But there's a slide in here which someday will come up. I actually feel like I'm in college 101 every time that slide doesn't, the next one will be good. This is a slide that we've used with you in the past, and I tend to use it in several presentations. There are a lot of words on it, but when you have a moment to think about what these words are, it really does give us a feel of what community health is all about, and that is our business. Community health centers truly are in the business of community health, and by working with Public Health and Human Services, it really supports us to expand beyond the exam room. It expands us to be able to provide services that when our physicians and nurse practitioners work with patients, they can say, there is this supportive system out there. This will assist you in doing what is of value for your health. So this is simply, I like it because it's also a rainbow. This is simply a facet of the colors of who we are, and that if we begin with our own individual health, which are the social determinants, we begin with our age, with our gender, with our genetics, and as individuals, we bring many components to everyday life, and we go out into our public services, our communities, our transportation systems, our economic development. These are all things that you all deal with day in and day out. Our living conditions, our working conditions, and ultimately we are supported, many of us, by our social, economic, and our political systems. And these words are just words on paper, but when you really spend time thinking of them and talking with your neighbors and your colleagues, we have the good fortune to actually be able to provide community health, and that's what we do. That's what we do at the Sawtooth Mountain Clinic, and in working collaboratively with you all. So that's my very brief introduction, and I want to thank you for this opportunity. And now I am going to turn it over to the staff that really does the really good work. So thank you, Teresa or Hartley. Whichever one of you is going first.
All right. Well, from January to December of this last year, we had 655 direct contacts. That means a person to person, but over 20,000 online. So we've really expanded this last year our online presence. Boreal has been really helpful in that. They do a bang-up job of getting things on the front page and right where people can see it, and those numbers are partially reflected in that. The blood pressure and blood sugar screenings, the number that we did of each one of the things that are going to pop up are in blue out to the side. So we did 98 of those, 133 for foot care. The maternal and child health and childbirth, we had 110 new families come through that program. This is the kind of a wrap-up with the traditional and new media. That's things like the topic of the month. And I have a pile of them for you sitting on my desk at the clinic. So we'll go get them. They're quite impressive.
Well, the fun part is, Hartley, when we talk collaboration, Hartley emails them to me and I send them out to all of you. So you're part of that countywide email list where everybody's getting Hartley's topics of the month, monthly.
And hopefully they're
So
not.
it's been a great collaboration that way and getting the word out.
Well, thank you. Because of you, they don't just sit on my desk. I go on WTIP. Amy Marie Schmidt writes oftentimes what are companion articles to the topic of the month, and then they're in Northern Wilds. Things are posted on social media. We've also started, whenever possible, both live streaming and then archiving programming so that people can, if you live far away and you can't get into the class, you don't have to miss it. You can, oftentimes people will be able to live stream it, and then so they can watch it again at a later time. And then the community events and programming. So that's where we get the 20,000 plus. Move It this last year, there are the numbers for that. 48 individuals in February, 30 individuals in May, and we're ramping up for Move It starting again in a couple weeks. It'll be a slightly different format. It's going to go from February through May, but keep your eyes peeled for that. We've also had a Living Well with Chronic Disease class taught by Chris Angelo and Bob Carter. She did some chair Zumba classes. Last February, Cammie Norland came and spoke with us about resiliency. We had a packed house for that one. The Caring for Our Whole Selves project, this was the first video in a series of 4. I can send you the link if you'd like to see it. It's called Tree Roots Grounding. It's just a little relaxation exercise to help kiddos kind of learn to amp themselves down when they feel themselves getting wound up. And that's on YouTube. It's had 165 views so far. We did 2 hot potatoes and tater tots classes. The hot potatoes are intended for parents with tweens and teens, and the tater tots are for the little ones. We had 64 in person, but we've had 369 archive video views. So this was my first foray into that, and that was really heartening for me because my hope was that it would work like that, and it did. I've made this presentation 3 times now. Our Consumers Driving the Food Industry Bus, I was invited to be part of last year's Winter Speaker Series, and then I've gotten to do it a couple more times to a total of 84 people for that. And then Mary Zabraki, she is the registered dietitian at the clinic. She does diabetes education, and she's taught classes for us. We were competing this year with empty bowls, so we didn't have so many in person, but we have had 139 videos viewed. So that says to me that there's at least 139 people that know where they can find that information, even if they haven't accessed it just yet. And now this is Teresa's.
So, most of you are aware of the WIC program. It's Women, Infants, and Children. It is a federally funded program. The monies are funneled through the state and into the counties. We've been running the WIC program since 1998. Our numbers have steadily increased since then, and we're probably plateaued around 123 to 125 participants, give or take. So it's for women who are pregnant, postpartum, infants and children up to 5 years old. It provides nutrition education, food supplemental vouchers for them to supplement their food. I'm very proud of this. I have Kristen Wharton and Amy Marie Schmidt, who also work under, and Karen Gallstrand is our new WIC clerk. And they create a very warm and welcoming environment, and work really hard at not making people feel like this is another welfare program, and they're really there to support new families. We have and an adjunct program with that also is the WIC Peer Breastfeeding Program, and that's run by Kristen Wharton. And Christina Riddlebauer is our peer breastfeeding mentor, and she's a lay person that is hired under this program to contact new moms and help to support them in their breastfeeding efforts. And we have been, Cook County has been recognized through the WIC program a number of times for having one of the highest rates of breastfeeding initially, and sustaining breastfeeding up to 6. They look at it at 6 months, and then they look at it again in a year. And we've had some of the highest, sometimes even the highest rate in the whole state of Minnesota. So that's, I think it speaks to our community members, and I think it speaks well to the program. The food package changed a couple of years ago, and I think the most, personally speaking, and I think it's well supported by the members of the program, is they changed so that they have a separate standalone voucher that you can purchase fresh fruits and vegetables with, and that really has been welcomed and a really positive. We've got a lot of positive feedback from participants from that. So that's, and the federal portion of that program, they're continually looking at how to improve the food package. So And then the Child and Teen Checkup, that's another program that we have collaborated with Public Health for the same amount of time. It's a benefit for families who participate in medical assistance or one of the Minnesota Care insurance plans. And it is well child checks that are provided under their insurance. And the clinic has worked very closely with Joni and the Public Health Department to implement some changes that the Child and Teen Checkup has required of the clinic. As an example, they want us to apply fluoride to children's teeth. And there's more depression screening for children. There's more HIV screening. They've really broadened their requirements, so it's made for a bit more work in getting those things rolling, but in the long run, I think it will just enhance the well child checks that people are eligible for. And what we've done at the clinic is we haven't segregated this population and say, these are the components of your well child check because you fall under a Child and Teen Checkup. Everybody who walks in our clinic gets the same components of a well child check, whether you have Blue Cross Blue Shield or whether you have MA. I just think that speaks to how we just want to have the best for everybody who walks in the door. We do budget and quarterly reports. Like I said, all those. And the clinic, the state downloads, the names of people who are on MA, and then we send out reminder records. We have a really good internal reporting and availability in our computer system to keep a reminder letter sent for people when they're due for well child checks. So I think we're really up on that, of just keeping people in the loop of when you're, and we've got, our doc schedule is out many months now so that we can, they come in for a 4-month well child check and they can get their scheduled 6 months well child check as soon as they walk out the door and so on. So. One thing we didn't mention before we started is that Maren Webb would have been here, but she's not feeling well and also has a sick child. So some of the things that Hartley's going to address under the SHIP is Maren's responsibility. So bear with us on giving you the information that she is the expert on. So I'm going to pass the rest to you, Hartley.
SHIP now stands for the Statewide Health Improvement Partnership. It was changed in the last year or so from improvement program, and I really like this idea of partnership. I think it speaks better to what SHIP really is about. One of the things that I've been impressed by is that nobody's ever told me from on high what I need to do. They've given me tools that then I can help work with to figure out what's going to work best in our community. And so there's great flexibility in that, because what we need is going to be very different from what Hennepin County needs. So we do have that flexibility. We talk about things like making PSE changes, and the PSE. I've gotten so stuck into the policy. Thank you. And that's Maren's baby. She's got a master's degree in public policy, and so she speaks that so fluently. And I'm really grateful to have her as a compatriot in that. And then systems and environment, because we know that if those aren't in place, if we have policies, systems, and environment that make it hard for people, we can't expect them to easily make the kind of changes in their lives that they need to.
I'm going to interrupt you
Yeah.
just for a second. One of the things that Hartley mentioned that I think is well worth restating is the SHIP program improvement in partnerships, this is a real Minnesota program. There are programs that may kind of align to it in other states or may kind of look like it in other states, but for however it really happened in the wisdom of the Minnesota legislature, this really is a Minnesota program, and I think that it attests to the health of how hard we work to really provide quality health care. And I think the piece that you stated that really, I think, underwrites a lot of what we do here is it really is set up as a program to work with the peoples and identify the needs that are individually, that individually come from that communication, as well as what communities need, defined as communities. So we have the freedom to really better understand those needs, and I think that's one of the beauties of this program. And honestly, I know Joni and Teresa certainly have listened to me over the years, but I wouldn't have bet ever that this program would still be here. This was, the baby of someone, and they talked it through, and the legislature supported it. And here we are many, many years later. I'm not exactly sure how old this program is, but it's really a testimony of how well it is working. And I think all of us who get the opportunity to work with it really
Isn't it
deserve to be
10
proud
years
of it.
old in
It's
Cook
9
County?
years old.
Is it 9 years old?
Yep.
Yeah.
And Rita, you're speaking so well about the P and the partnership piece, and what an amazing collaborative project, and how you as county commissioners, along with legislators, continue to support this good work, and that the work that the clinic is doing through funding that flows from here to there is changing people's lives. And that policy piece, which many of you have sat on the SHIP policy group that way to make some of those changes. And Bobby, even with your work at Grand Portage, has made a difference. And as you too know this language, living in community and the good work that Grand Portage is doing under SHIP initiatives too, this has just been an amazing piece that, again, not only Cook County, but all of Northeast has been looked at as stellar examples of making amazing change in this work. And thank you for your support in that.
So the areas that we've been working on historically have been food access, worksite wellness, and then active living. So and here's one of the ways we've been working on healthy, affordable food access. This is a picture from the Thursday evening local food market, and Ian Andrus's bounty. If any of you have made it out there, you know what I'm talking about. This year, we had 8 or 9 vendors each week, 30 to 50 shoppers each week. This is held in partnership with the Northwoods Food Project and Cook County Extension. It will be happening again this next year, so there'll be more opportunities for that.
You also made it possible for those with food support to participate.
I was just gonna say, we're working on getting the EBT machine available there, so people they could use some of their food support dollars to buy fresh fruits and vegetables on the market.
Which is I think
A
gonna
long
be
time coming, and it wasn't
It
easy.
is. It's a goal for 2018, so we're very excited to see it happening.
Yeah, it's going to be a game changer for a lot of people, because suddenly this is going to look like a really viable option.
Heidi, I think you make a good point that it's been a goal even in 2017, but some of these changes with federal systems take a while to implement.
This 2017 was the first year of the Workplace Wellness Collaborative. And in our first cohort, we had the county, Arrowhead Cooperative, dentist's office, higher ed, the Y, and then we participated as an individual entity too. We're in the process of hopefully gearing up for a second cohort. We've had some interest, and I extended the deadline a little bit, see if we can get a little more interest drummed up. And this first collaborative will, out of that group, The county, the dentist's office, the Y, and the clinic have chosen to continue as what they call a networking group, an alumni group. So we're not just stopping after the first year. We're going to keep the motivation and the momentum going and keep making the changes. And that's part of the goal of the Wellness Collaborative as a whole, is not just to have it be a one-off and, okay, what's one or two changes we can make, but to really give workplaces the tools so that as they evolve, they can continue to evolve this idea of wellness in the workplace and how can they meet their changing needs. This is Marin's wheelhouse. And she has done a lot around active living. The Safe Routes to School happens multiple times in the school year. This fall, there was one event where the volunteers from the football team went and walked with young walkers and bikers to school, and I think that was really very well received. The little kids enjoyed getting to walk with the big boys, and whether they admit it or not, I really think the big boys enjoyed walking. The third grade in-school bike education touched 42 kiddos, so there are 42 more kids out there that know about helmet safety, that know how to signal a turn, that know which side of the road to ride on. So they will be really able to use that in a safer way. The bike safety rodeo had good numbers again, as it always does. 68 children and 30 parents. That's a lot of people learning about these skills. And then the partnership with the city of Grand Marais for the Highway 61 project and comprehensive planning that is looking at planning for a future and paying attention to health impacts of that planning at the same time.
Just a comment with the bike piece that you may not be aware of is SHIP sometimes provides monies to purchase some items, and one of the pieces we did locally was purchase collapsible bikes and a means for transporting these bikes, so the schools are able to not only access the education in the school and learning, but they actually get on the bikes and learn within the gym how to ride, and then they get out on the roads and learn how to ride. So some county commissioner day, maybe we'll see them coming down the hill because this is one of their routes. And so we're not only providing in-house education, and again, it's partnership because it's not Hartley and I and others, but it's recruiting people who are actually trained in bike education to do the curricula and to implement it, and it's a very exciting program.
All right, and that's on our part.
The individuals that are listed there, that we really reach out and try to tap into as many staff, and then we look to community members too. So for expanding programs, they may not necessarily be part, excuse me, of this particular program, but if they have the talent, and I happen to know they have the talent, then I'll just go to them and ask them to also participate and help us as part of their job at the clinic to make sure that certain components are done as well as we can provide them to be done. So I think that's, if you have any questions.
Thank you so much. We will open it up for questions, discussion. Anybody?
Yeah, I have one.
Absolutely.
When you got back to the child and teen checkup there, you were talking about depression in kids.
Mm-hmm.
Did you see like a fluctuation in numbers with the social media stuff? Do kids have?
You know, Robert, the screening for depression in children was just initiated in October of this year. And so I can't answer that. I don't have enough data to even answer that for you. But that's a really good question in relationship to all that information out there about social media and what that potentially has to do with mental health. Yeah.
It's a really good question. In fact, I actually think probably that's something from all of our funding sources, we will be asked to begin tracking including the federal grants that we receive. I think it's a really important piece.
We do have 2 depression screenings that we currently use at the clinic. One is called a PHQ-2 and one is a PHQ-9. The PHQ-2 has 3 basic questions regarding how you're feeling, your mental health. And then if you test high on that, then the PHQ-9 is offered, and that is a more extensive questionnaire for kids. And we start at age 11 to do the PHQ-2. And so those kids are beginning that screening, and that's been implemented. We've been doing that as a clinic ourselves across the board for a couple, 3 years probably, as part of one of the initiatives we've been trying to do to address that mental health portion. And I think too and this is probably a little outside of the collaborative effort, but just to help you answer some of that question, we have 2 behavioral health consultants that they also they're invited, if parents are comfortable with that, to come into well child checks, even from infant on up, to just introduce themselves, let them know that they're there. If they have any questions or concerns regarding their children's behavior or mental health, they're there for as resources. So just to give you kind of a little more information.
Yeah. And I had another thing on the SHIP program. I believe on this Wednesday or Thursday that PBS is going to be in Grand Portage with Tess and Andy, and you're going to be with them through the whole day filming it, and then they're going to be in the school and then
Great.
house, and then they have their program in the evening. They're going to film that also. So
Boy, that's really good to know. Thank
yeah,
you.
it
It's
really
an
took off in
incredible
Portage.
program.
So
It's an incredible program.
Your SHIP program is so robust up there.
Yes.
It's very, it is. I mean that
Yeah.
genuinely. It's very
Yeah.
exciting with
Yeah.
the creative garden that you have
Mhm.
created. Yeah, it's great. That's great.
okay.
Okay. Yes.
I just wanted to say it's amazing everything the clinic does, and is very valued by the community. But as you talked about children with mental health issues, and I don't know in Cook County who might be interested in doing this, but a really effective thing to do is to have some child mental health people get together a checklist for depression, for anxiety, all the different kinds of disorders, and give it to teachers. And then there's early identification. And actually, I once went to Children's Memorial in Chicago, psychiatric, to see some teens, and the elevator opened. A whole bunch of 2-year-olds were admitted to the hospital. Can you imagine? With all kinds of serious psychiatric, they were coming off the elevator, disorders. It was really eye-opening. So it goes down really young, and where I worked, we developed it for all the Jewish preschools in metropolitan Chicago to pick it up early. So if someone wanted to work on that, it's invaluable. The teachers would always say to me, if I was involved, like, this was so helpful, and then I could talk with the parent and I could observe it, and I became more aware of when to kind of start planting seeds. And it isn't always treatment that they need, but yeah. So it's a thought.
That's a great thought, and I will bring it back to the behavioral
Okay.
health consultants that we have and see what resources they have
Yeah.
and talk more about that. Thank you.
Yes.
Thank you, Madam Chair. Your presentation really speaks to the complexity of the, not the idea of health, but the actual creating of health. Obviously, we've come a long way thanks to you folks, and I really appreciate your efforts and the state's efforts and the federal efforts, and but also how you've all gone to bat to keep those things, and that's a huge task in and of itself, that going to bat on a regular basis, never being able to take anything for granted, never really being able to relax and just enjoy the fruits of your labor. Your labor, you're always having to fight for tomorrow's health. So I really want to thank you all for your fabulous efforts.
Thank you.
Anyone else?
Well, I want to thank you and commend you for the work that you're doing in the community. I've been a long-time advocate of healthy living and dealing with not just medical issues but other issues, because it's all together. It's body, mind, spirit, and so that's great. I was in a conversation yesterday with a couple of people concerned about a certain issue, and we really wanted to, emphasize the importance of trying to serve all children. And you've done that with your dentistry program, and whatever you've had to do with that is just
Oral health task
a
force.
great, oral, and that's really a significant thing, and not only with health, but I think to send a message to the community that we care, and we're going to take care of our own the best we can. So some of us might be talking to you at some point in time about maybe expanding some of those kinds of things within the community.
We're here. Thank you. It's a gift to us to actually be able to do this work. I actually feel very blessed to work with the people I work with there, and with all of you. It truly is a gift. So thank you very much.
I have a question about the SHIP program. Is that also federally funded or mostly in the state?
SHIP is a state program.
Yeah, okay, okay.
Mhm. In fact, outside of the dollars that may help and assist us in leveraging on other, on the county level, on this federal level, the SHIP dollars themselves are strictly, as we've presented here, strictly Minnesota state dollars.
So it's important when we talk to our legislators to keep this going, of course.
Yes.
Very, very important.
And just a note for the public too, on Wednesday at the Tofty Fire Hall, a representative from Congressman Nolan's office will be there at noon to 1. So it's our chance also to encourage our representative to think about us in the Northland.
Please do.
Okay, anything else? Well, thanks again so much, really
Thanks
appreciate
for the
this.
invitation. Thanks, Allison. Appreciate it.
Thank you all for being here today, and just wanted to mention one more service that's really valuable to our department that again is outside of the scope of our public health partnership, but is the navigation services that are provided through the clinic for helping people assisting consumers in applying through the MNsure program for medical assistance, Minnesota Care, and those private plans. That is something that we value so much in our agency in getting people connected with those services. We're very grateful for that as well.
Thank you. Allison, you bring up a really good point that I think is worth mentioning, and that's the coordination of care and support.
Mm-hmm.
And that truly is one of the programs, the Navigated program. And I was just in a conversation yesterday, actually, on the complexity of being insured. And I have to admit, I feel lost in the world of insurance. Excuse me. But the beauty of having, and the good fortune of having dollars and funds that support individuals on our staffs who can actually help and assist people to truly navigate the health insurance complexity world it's invaluable, and it's in the same way we all are starting to use the term care coordination. Well, truly, to have someone help navigate a system that's as complex as the healthcare system, I don't know if we've ever touched upon something that's quite as valuable, because it really helps. It helps all of us reach the physician we need to reach, communicate back and forth, and then continue out. And that navigation, I find it always fascinating in the years I've been able to work in this field, that the really pieces that I feel are the most valuable, that rise to the surface, are of course the ones that don't make the big dollars and that don't bring in all the money, but they tend to be the most valuable services to our people. And that's one of them. So thank you for mentioning that. I forgot. Left that one on the table, forgot. Thank you.
Thanks for being
Thanks,
here.
Mel. Have a good day.
You too.
Thank you.
I just want to say we didn't bring in many people. The crowds weren't very big.
It's because you're not controversial.
It's a nice crowd on the front lines. It was
Yeah.
awesome.
Okay, so we'll move into the director's report.
I just have a few brief updates this morning for you because I want to make sure that we have enough time to discuss the year-end report that our advisory committee developed. But in your meeting materials, I shared a summary from MAXA, that's the State Human Services Directors Association, Minnesota Association of County Social Services Administrators. And those are the 2018 legislative priorities. I just wanted to share a hard copy of that summary. I gave a brief snapshot of that last month as we had just spent the time prioritizing those positions. A couple of things that I just want to call out briefly from that summary is the investment in regional crisis facilities and permanent supportive housing for people with behavioral health needs. That is something we're looking at as a region within the Region 3 counties. Some of the other positions are related to removing administrative burdens and shifting costs that were shifted to the counties. For example, with the MIN Choices assessment, those are the screenings for long-term care services for people who need services to stay in their homes, elders or people with disabilities. Some counties or some costs were shifted to the counties in the last legislative session, and one of the priorities is to sunset that county cost share. So pretty self-explanatory, not really controversial position statements there with looking at the funding of those programs. On December 19th, after our last Human Services Board meeting, the stakeholder group for the Community Health Assessment met again. We reviewed the information from the Community Needs Survey and spent some time going through a World Cafe process to look at the priorities for community health needs that were identified at that first stakeholder meeting in October, and then again through that survey that was distributed. We will meet again with that group to develop our community health improvement plan. From the presentation from the clinic this morning, you could see some of the initiatives that came out of our last plan 5 years ago in 2013. Some of the priorities were around behavioral health needs and food access. So the example of increasing accessibility at that farmer's market for people who rely on food support to meet their nutrition needs, that's a goal that really aligned with that process we went through last 5 years ago. A couple of agency and staff updates. We're in the process of hiring the mental health social worker, the adult mental health case manager position. We will be conducting interviews here in the next week. We are also still in the process of filling that office support case aide position that was vacated with an internal promotion within our department. So that position required a test, so we have yet to receive the list of applicants for that position, but hope to be filling that soon. Yafa Napodensky, our fiscal supervisor, announced her intentions to retire early this spring, so you'll see in our items for board action that we're requesting to accept her leaving that position and requesting to fill that immediately, or to post that position immediately, just to make sure that we have enough time for that person to spend with Yafa, because of the amount of it's a very steep learning curve, let me just say, for that position. There's a lot of complexity in the reports and the budgeting and the various work that she has to do in that position, so really want as much time as possible for cross-training. After that position and the two vacant positions, the only Other vacancy in our department right now is that public health nurse position, the second position that that has been vacant now for over a year after Allison Heron left. We weren't able to fill that position last summer when it was posted. It was initially posted as a public health nurse. Then we looked at public health coordinator just to see if changing the qualifications for that position might help us in filling that. And now it hasn't been posted for the last several months. So Joni and I are meeting tomorrow to look at those core competencies of the public health department, to look at, what are some of our service gaps, what is she prioritizing, and what is missing, where are our gaps in that department, and looking at how to fill that position, if it's filling it as it's currently budgeted at 37.5 hours a week, or if there's potential to look at where we've contracted with other community partners to provide those public health services. So I'll certainly keep this board in the loop as we move forward with planning for the public health department. And then just to mention too, I neglected to pull the updated data on the number of applications. I'd hoped to share that on a monthly basis, but I'll bring that back next month in the last 2 months of data on the number of social services intakes and then new applications for financial assistance in our department. And just one more note, staffing-wise, about the items for board action is that items C and D. Those are hours, changes in hours for 2 of our support positions. Just wanted to note that those were both included in the 2018 budget. We're just bringing that before you today to get the formal board approval for that change in hours for those positions.
Okay. Do you think, what do you think as far as advertising for public health nurse? Did you get any applications, or is there a criteria that you're going to look at besides the hours?
So when that position was posted, it was before I was in this position. So I'm not sure of all the details of that, but I believe that we just weren't able to find someone who met the qualifications, or that those who did declined a position.
Okay.
But we'll be looking at all those factors when we meet initially tomorrow.
Well, and it always comes to mind about housing. If it's someone who would see that advertisement to move to the county and then be considering that too. I know that that's been the situation with the hospital and the clinic also, is the housing. So we hope this year we're going to work on that and get some alternative and wonderful apartments up for people in both areas of the West End and Grand Marais. So did you want us to do board action now, or did you want to go to the year end? Do you have anything to say about the year end?
I would just hand that over to Carla to give the summary. Jerry wasn't able to join us today, but he wanted to say that he's fully supportive of this year-end report that the committee put together. And thank you to Sarah for doing a lot of the upfront work on that summary report, going through our minutes and agendas to really summarize the work that committee did over the last year. And we did have the chance to review this with the committee last month and get a lot of great feedback from them as well on summarizing the work. But with that, I'll
Okay. Well, for those of you who will pass them around, those of you, Jerry wanted everyone to know that he had on both hands carpal tunnel syndrome surgery on Monday, and he thought that he'd be able to come back and be here. And then the roads yesterday were in parts really difficult going to Lake Walk, and so they decided to hunker down and spend the night there and just chill out. But he sounded wonderful, like an hour post-op. It was like he never had it, So apparently it was successful, so he wanted you to know. And I also wanted to mention, as Allison did, that Allison and Jerry and I and Sarah worked on this and then presented it, but I just wanted to give Sarah the Artistic Director Award. Yes. Yeah, she did a beautiful job on it, I think. So this is the first time that the advisory council's done this, so as you are going through this with me, in the end, if you have any ideas of a different format or what would be helpful, or later on throughout the year if you do, we would like to know that. So the first part, the first page really just kind of tells you that the advisory committee seeks input about public health and human services delivery system, and the committee makes program and service recommendations to Public Health and Human Services Board and to the department. It's really, I think, a partnership of the agency staff and local providers that are on it and citizens that are on it, and we see ourselves to be supportive of the organization as the main role. So what really it was really a year of a lot of changes, I think, which led up to the fact that we now need to do an annual report, which this is. And we meet every 6 months. So every other month we meet. And in February, the advisory committee recommended changing the name, which you all approved in that February meeting, to the Human Services Board, to the Public Health and Human Services Board, from just the Human Services to include Public Health. There was also a revision made that the committee worked on of our bylaws, was beginning to form in February. By March, the bylaws had been completed and were approved by this board, and really spelled out in more detail the responsibilities of the committee. In March, we also added more members, and we were up to 11 members, not including a county board member, which would be Jan and the staff that attend this. In that March meeting, we also met with Land Services and with Environmental Health and Public Health, and talked about the septic system compliance issues, and had a good general discussion that led to taking on further steps by the county attorney's office and Land Services to encourage this so that it wouldn't be a public health issue. The other thing that came up in March at the meeting was a staff presentation about whose role it was, I think, and to do the medical assistance applications after clients are in the care center. And there was a lot of discussion about that led to the director and others at the care center meeting and working out a more satisfactory clarification of that and making it a smoother process for the residents. And then in May, our conversation really centered a lot about what was going on, as you'll recall, between with the YMCA daycare and daycare in general. And Josh had spearheaded a whole organization of people working on daycare. And at that time, there were some concerns regarding licensing at the daycare, and that resolved itself, and they got their proper licensing, or worked on it for that. While daycare remains a critical issue, I think, from what we hear in the community, the lack of daycare, the YMCA was able to rectify their situation. In July, one of the things that happened to us is we formed a subcommittee to review the non-mandated discretionary levy funds at Jeff's suggestion, and the committee did review it and did make recommendations, and then either it was helpful or it wasn't, but the board considered those recommendations.
Thank you.
In August, we always found we meet for an hour and a half, that we had time constraints. So by August, we thought we needed to hold a special meeting just directed to focus on the bylaws, because they enlarged our role and how we would handle everything that they said we would do. And so we met and did that, and we felt going forward we might have to form some subcommittees in order to meet the agenda that was set forth by the bylaws. And then in September, I think due to all of the changes that were going on, for the first time, the chair and the vice chair went to the Public Health and Human Services all-staff meeting, and that was really a treat for the two of us to see such a well-functioning unit. And it was very uplifting. We thought maybe we were supposed to lift morale a little, but it was the other way around. By October, we participated, the focus then was to participate in the community health needs assessment, and I believe it was 7 of us a large number from the advisory council came and did that and enjoyed that process. In November, we reviewed that survey and talked about how, what the issues might be going forward and how we had seen it in Cook County. And we also talked a lot about the format for this end of the year report, how it would be, whether it should be detailed or not. And we also added a new idea to our agenda, which we just called a roundtable, so that we thought it would be good to go around as citizens and providers and bring up any issues we might be hearing in our communities or wherever we had been that might be pertinent to the service delivery of the agency. And so we did that. And in December, again, the same members attended the Community Health Needs Assessment, and Cook County came out prioritizing financial instability, social inequality, services for elders, and healthcare access, as well as alcohol and drug abuse. So all of that will be worked on, thought about, and prioritized further. Now I'll be Jerry. This part. The committee, we tried to look at what were our strengths, and we thought we were committed, energized citizens and providers. And I just remember my Dragon Boat days paddling, and there was a Dragon Boat team called the Fired Up Puppies. I think that kind of reminds me of some of these citizens. We felt there was an increased cohesiveness in our group membership, and that there was a stronger relationship between staff and committee members, that we felt like we really had a relationship instead of just being an audience listening to reports. Areas that we felt we needed to improve in was the time constraints on the agenda, and so we need to think about that and how we could be more effective with our use of that time. And there are at times difficulty over the years in recruiting citizens to the committee. And currently we have one opening. It would be ideal because we're supposed to have someone who had some relationship with the agency, themselves or a family member or something. That's always helpful, but that's not that easy to find. And then we had a number of member absences, and while they may have been excused, you lose some groundwork if someone's gone a lot. We established goals, and of course we always get carried away with what we're going to do, but implement the new bylaws which significantly change the duties of the committee, continue to strengthen the committee's relationship with PHHS staff as a support by bringing relevant community information, evaluating and making suggestions on agency services as requested by staff, clarify the committee's role in statutory mandates to evaluate the adult and children's mental health services, review and make recommendations for updating Cook County's tobacco ordinance, including e-cigarettes, actively participate in the development and implementation of the Community Health Assessment Improvement Plan for Cook County, continue to advise the Human Services Board on issues regarding non-mandated levy request, engage in a strategic planning exercise to facilitate setting future goals that include increasing interagency collaboration, and regular follow-up and review of issues and initiatives and actions taken, including the designation of a committee or an agency contact person responsible for follow-up. And then we had an impact statement. The revision of the bylaws with increased responsibility directed to the committee resulted in more focused, purposeful, and tax-centered task-centered meetings. The staff shifted from largely updates to bringing service issues and community issues for discussions. And we've already talked about some of those examples with the daycare, and the North Shore Healthcare, North Shore, whatever, the care center. And talked about that and others. And so that's what we did over the year.
Wow.
In a nutshell.
Yeah. So I don't know if that's detailed enough or.
I like the fact that you go by month. I'm kind
Okay.
of a sequential kind of person, so you started here and now you've ended up there. I like that idea, giving a monthly, sort of bringing it up to date to where you are now.
Oh, I just realized that should have been January. Right? We owe it to Sarah because for keeping great minutes, which I'm doing now, I tended to just go home and throw them out, and now they're saved on my computer. But anyway,
Could you review who's on the committee? You and Jerry?
let's see.
Or are there a lot of people?
Yeah, yeah, well,
Okay.
the staff, Allison comes and Sarah comes, and Jeff came for a while. And any other person that it would be relevant from staff, right, to be there, Allison? Yeah,
I'm just pulling up the membership.
right.
list.
Okay.
Oh, there we go.
Well, okay,
She
go
probably
ahead.
knows that.
I'm trying, this
This
is
is
an
good.
elder assessment test. This is really good. And then we have providers, and we have Roger Linehan from Portage, and Cecilia Bloomquist from HDC, and Rita from the clinic. And is there another provider?
Got 'em all.
All right.
Okay,
We've
good.
got
All
Francis
right.
Jarko is a citizen, and I am, and Jerry, and Eddie Hertzberg, and Wendy Hansen. Mm,
Do you want me to get the rest of them? Steve
Oh.
Nielsen.
Oh, yes, Steve, yeah. And Frank's.
Frank Seal. And Pat Campanero.
Right, okay.
Okay.
That's all.
It's a pretty big herd of cats, with, like you say, or puppies,
Right.
with a lot of enthusiasm.
Many of them have a background in human services of the citizens. So I think that fires them up even more.
Right. Okay. Comments or questions?
Great work.
Good work is right.
Madam Chair, I just maybe should comment in regard to childcare. There was a group of people that met yesterday. Allison was there, I was there, and Sarah Cole, the CEO of the YMCA, and Emily Marshall, and Bill Hansen by phone. He was down with the bug, but we had a phone conversation. And it was just sort of a formative discussion about where we've been, where we're at, and since it's mentioned here, we had a pretty good discussion about maybe how we could proceed. So at some point in time, we need to interact because it seems like this is an issue with you, but it just seems like there's been a gap, in dealing with this in the community. There was a coalition, and that's. So I don't know what that's going to shape up to be, but we selected Bill Hansen to be the facilitator.
Oh, okay.
And so we're looking at reaching out to the business community, other groups in the community. And I think there's been some political kind of issues going on with this, and we're going to try to really work through that in a very, responsible way and respectful way. We're reaching out, the goal is to have childcare for every child. And so there's going to be various players and stakeholders in that, and hopefully that this group will evolve into something that's not going to be connected either with the county or the Y or anyone else. It's going to try to be, reaching out to the stakeholders and see what we can do. It is remarkable that we have a real need here, but it is not insurmountable at all. It's, we can do this if we just work together. So I think the idea is to try to be some kind of network of facility, and I alluded to maybe even the clinic on a community health issue, that there'd be some kind of, you know, facilitation body or networking kind of facility where we can help and direct that. And we do have commitment from the Lloyd K. Johnson and Northland Foundation to commit to this, so that's part of the picture. But we want to make sure that we're sustainable and that we are not dependent on necessarily grants long-term. So it's timely. I just thought I'd
That's wonderful.
comment on that. Don't know what the answer is, but we're going to work on it.
Wow.
Where there's a will, there's a way usually.
That's right.
And the fact that that particular area of childcare is really important to address, as we have looked at it over a year and a half now. So, thank you for being involved in that. Anybody else? Okay, well, thank you, Carla, and hats off to the advisory group, and keep up the good work and whatever we can do to help support you too. Appreciate it. So we'll move on to items for board action. The first one is being the election of the 2018 Public Health and Human Services Board Chair. Open to nominations.
Who would like to do it?
It's one of the easier pieces of work to do.
Would you want to continue?
I'd prefer not to.
Okay.
So I will hear any nominations. Anybody want to volunteer, or? how
Well,
do
that
you-
would be nice.
Will I open that up too?
Yes, that would be awesome.
I'll nominate Heidi for it.
Yes.
Support that.
Yes.
She
Is-
accepts.
How does Commissioner Dukert feel?
Yes.
Not,
Does that work?
not entirely excited, but since no one else is jumping up, just want to clarify that I very much support the Public Health Department.
Yes. As we all do, of course. Okay, so any other
Thank you.
further nominations? Okay, so do I hear a vote for this? All in,
Aye.
all in favor?
Aye.
No more discussion, so.
Thank you.
Very good. Okay. So I will complete this, and then you will take over in February. Thank you, Heidi. So the rest of the action would be to accept the resignation, change hours for both office support specialist and for Katie Smith. Yes.
Motion to approve items B through D.
Do I hear a second?
I'll second that.
Okay. Any discussion? All in favor?
Aye.
Thank you. Moving on to committee reports, we will start with the Arrowhead Economic Opportunity Agency.
We haven't had a meeting since our annual meeting, so, and I haven't heard about the next one yet. So I'm sorry I don't have anything to report.
Okay, thank you. Arrowhead Health Alliance Joint Powers.
Thank you, Madam Chair. We haven't met since before the last Public Health and Human Services Board meeting, but we will be meeting in February. I plan to attend.
After the first of the year, things are off to a slow start.
Yeah.
With a lot of different groups. Arrowhead Regional Corrections.
This Friday we meet.
Okay. We'll hear about that then next month. Community Health Board.
Thank you, Madam Chair. We met in early December and haven't met since. Again, the new person will be Commissioner Dukert, and
Okay.
I would imagine they'll be meeting in February. Great.
Okay. Public Health and Human Service Advisory Board.
The only couple of things are that Roger Linehan is retiring in Grand Portage. I think it's the end of the March. Is that right? And he said he would stay on if they could, for a little bit if they couldn't get anyone. And the other thing that was interesting is Cecilia said about not interesting, but said about HDC, but that they are feeling a financial pinch and they're okay through 18, but they're feeling like they have to really look at how they're spending their money and be as economic about it as they can, economical as they can, and that they can't grow the agency anymore if they wanted to at this point. And Rita also had talked about so far that CHIPS had not been funded by Congress, and it was stalling, and the Band-Aid was for 90 days for that program. And she said something that was kind of startling but true. I think we know it. She said she saw in the new tax law, she saw just the part that pertained to health care funding, and she said that there were drastic cuts to the Affordable Health Care Act, and it impacted Medicaid and Medicare, and she said it would impact everyone in the room, and some of the people in the room are not on those programs, so we don't know, but it sounds like we all have to just really do what we can, right?
Thank you.
That's it.
Health Care Planning Committee, we did meet, and the same thing that Rita was concerned about the federal funding for the children's health care, probably through March right now, so far. And she commended Hartley. Hartley was just here on the communication that she's done through the clinic with the outreach program, and she gave her a gold star and said that everybody who knows Hartley and knows the work and effort that she does and puts out for information is stellar. Kimber reported on, they're concerned about ambulance drivers, and that they're going to have a class for EMRs, and that possibly the public could step up to work with, as being an ambulance driver, they need someone in that area as long as they take the class, and the class is being offered at the higher ed. So hopefully people will be interested in that. And Carl reported with the Northland Foundation there, the strategic plan has been done with them. However, they're calling it the implementation plan rather than strategic now. So implementing what they've already gone through. And they still have quite a bit of money in grants from 2017, about $28,000. So they're trying to get the word out on the criteria so you can apply for that grant money for an individual group that needs some help. And then Cecilia did report from HDC that what they want to do is gets like a therapist grant to go into the schools, or into our school here, and they're working on that. But she did mention too, their budget was through 18 pretty tight, and so they're looking at how they can expand that service in the community. Well, moving on to North Shore Collaborative.
Didn't meet, we'll meet next month.
We're going to have a big report in February.
It's going to be huge.
Huge. And then emergency preparedness.
We
We didn't meet last month, and you meet next week.
Okay.
6:30 today.
So I'm on that. I didn't know I was on that. You're on that, Heidi?
No, you're on that. It's
But
chair and
I'm
vice
Chair
chair.
and vice
But
Okay.
last
But
month
last
it was
month.
Jan and I.
Okay, okay. Get all this straight, who's on first and who's on second. Okay, anything else to bring up? Okay, being none, I will adjourn the meeting. Thank you, everyone.
Thank you.